if you've just hit your head and you feel the symptoms of a concussion, what should you do? Hello and welcome to the channel. My name is Dr. Cameron Marshall, aka Concussion Doc from CompleteConcussions.com, and I am here to help you better understand concussion injuries. If you think you've suffered a concussion, then you're definitely going to want to stick around and watch this video because we're going to show you exactly how you can optimize your concussion recovery. Now, I should mention that this video is not intended to be medical advice. I'm not your doctor. I don't know your exact case and circumstances, so you should always be guided by a healthcare professional. This video is simply to provide you with an update on the current best practices to help you understand concussion better and help you recover faster. Now, in our last video, we discussed how to tell if you have a concussion. So if you missed that, I think that's the first step. Go back and watch that video. You can click on the link up in the corner here. This current video is part of our new series designed specifically to help concussion patients to optimize your recovery and heal your brain for good, whether it's been 10 hours or 10 years. If you're new to the channel, please be sure to subscribe and give this video a good old thumbs up. Leave any comments or questions you have below. We love hearing from you and we love answering your question. If there's something you'd like to see, let me know. And if you know somebody you think would benefit from this content, please be sure to share this link with them. If you are struggling with ongoing concussion symptoms and you want some extra help, there are links below in the description to various resources to help you with your recovery. I frequently host live webinars and post various helpful tools in these videos, so please do take advantage of that. So, if you've just hit your head and you feel the symptoms of a concussion, what should you do? Let's dive in. Step one is to see a healthcare professional, preferably with training and experience in concussion. Most people don't realize this, but concussion, up until about a few years ago, was not even covered on the curriculum in most medical schools in Canada and the United States. So most physicians, GPs, ER docs don't have a strong understanding of concussion, and they often will provide you with outdated advice, which now we know some of the things that are being taught to people, such as rest until your symptoms go away, that's actually counterproductive and actually makes people worse, but they're still telling patients to do this. So it is important, if you can find somebody with specific concussion training, that is one of the #1 predictors of concussion recovery. So several studies over the past 2 or 3 years have found that, the #1 predictor of recovery is how quickly you are in to see a concussion trained clinician. And the type doesn't necessarily matter. Many people think they need to see a medical doctor. You don't necessarily need to. You just need a clinician with a strong understanding of concussion. Now, if you need to find a concussion clinic, if you go to CompleteConcussions.com, we have the largest network of trained concussion providers anywhere in the world. So go on there. Hopefully, chances are we have a clinic near you. If we don't, hopefully we'll get one soon for you. If you know any good clinicians that could join our network and we can train them, then let us know or let them know to get in touch with us. So here we go. Let's talk about some of the evidence here. There was a study done by Anthony Contos in 2020 and was published in the Journal of the American Medical Association, specifically the Neurology Division. Here's the conclusions. Findings suggest that earlier initiation of clinical care is associated with faster recovery after concussion. Here's the key points. The question: do patients who receive clinical care sooner after concussion recover faster? The findings in this cross-sectional study of 162 adolescent and young adult athletes with concussion, those who initiated clinical care earlier, meaning within 7 days, recovered faster and were less likely to have prolonged symptoms which were lasting longer than 30 days than those who came in and initiated care at 8 to 20 days after injury. So getting in early sped the recovery after concussion. And this is not the only study. Here's another one. Positive findings during vestibular testing in the presence of cognitive impairment identified at initial evaluation were associated with increased odds of delayed clearance. Our data also support the mediating influence of time to examination. Prognosis of delayed recovery may have greater utility when symptoms are captured and tests are performed early after the onset of injury. Here's another one. The study adds to the literature by emphasizing the importance of early clinical care to quicker recovery in concussion and providing more evidence to support current consensus guidelines that advocate for a short period of relative rest followed by graded subsymptom activity. And we're going to talk about what that means beyond this. Here's a study that we did. This is from Complete Concussions, and we looked at all of the data. We have the largest concussion data set in the world, more than 50,000 patients that are on there, and we analyzed our data. The number one predictor of recovery was how soon they were in to see a complete concussion trained practitioner. Those that came in within the first 7 days were much better off than those who even came in at 8 to 20 days. So if you're in that early stage, the best thing you can be doing right now is finding a trained concussion provider to provide you with the right evidence, the right guidance to help you kind of get on your way. Now, I do want to mention red flags. Red flags are indications that there's something more serious than a concussion. A concussion injury by itself will generally heal, and if we do the right approach, we can heal it faster. But a red flag is a sign that maybe there's a fracture of the skull, potentially increasing pressure inside the brain, and maybe bleeding inside the brain. And there's certain symptoms that would start to appear beyond that. And so if you are with somebody that's just had a concussion, and if you're unsure at all, you got to go to the hospital. But here's some of the red flags that would tip you off. These are the things you want to be looking for in the first 24 to 48 hours after concussion injury. Severe or worsening headache, right? Because that could indicate increasing pressure inside the brain. Severe neck pain, that could indicate neck fracture, right? We don't just have to be concerned about the brain. If we've had enough force to the head, we can actually have spinal cord injuries, neck fractures, all sorts of things that we have to also be very concerned with. If the person becomes very drowsy or can't be awakened, seizures, decreasing level of consciousness, meaning they're kind of going in and out of consciousness, or they're starting to kind of deteriorate where they're starting to ask more questions. Where are we? Why are we here? And they just keep repeating themselves, and they're slowly kind of deteriorating over time. Unusual behavior, confused, irritable, weakness or numbness in the arms or legs. Again, that could indicate some spinal cord involvement. Unsteady on their feet or have a slurring of their speech. Fluid leaking from their ears. That could indicate cerebral spinal fluid that's leaking from their ears. Or bruising behind their ears. That could indicate skull fracture. And also 2 black eyes can indicate skull fracture. Vomiting is another one. Inability to remember more than 30 minutes before injury. Now, all concussion patients should be monitored for at least 2 to 3 hours by a responsible adult. Don't let them sleep in this time. The old kind of wives' tales is you shouldn't let a concussion person sleep because they'll slip into a coma. Really what you're doing is you're keeping them awake to be able to monitor for a worsening condition. If the person becomes super tired, and the reason they become tired is because of what's going on inside the brain. If you missed our first video, then go back and check that one out because we describe what happens in the concussion process. That is a clear indication why the person might be tired. But if they fall asleep early on, you can't monitor for any of these worsening signs and symptoms. So you don't know if they're developing decreasing level of consciousness because they're currently sleeping. So you wouldn't pick up the fact that they should be going to the hospital. So we generally like to keep the patient awake for at least 2 to 3 hours after injury and just monitor them. Just talk to them, keep them awake, watch them move, watch them talk. If they start then slurring their speech, okay, we got to go to the hospital, right? And if you are at all unsure or you want to kind of rule this out, take them to the hospital right away. You can't be wrong with that option. All right, this is for people that may not have that at their disposal at this point in time. Now, can you let them sleep that night? The old kind of thing was wake them up every 2 to 3 hours just to make sure that they were okay and they could be aroused. That has since kind of been abandoned as a recommendation because in the first 2 to 3 hours is typically when you're going to see this deterioration. Beyond that 2 to 3 hours, if they haven't deteriorated in that first 2 to 3 hours, the chances are they're going to be okay. But there are edge cases in which people can have issues that are a little bit slower acting, and you have situations where people go to sleep and they don't wake up in the morning because they've had a hemorrhage in the night. And so I typically still recommend to my patients just to kind of go in and wake them up for the first, for the first night. Just wake them up every couple hours just to make sure that they can be aroused, right? You don't have to wake them up and give them a math test and have them walk around the room or anything. Just make sure that when you wake them up, they're conscious. They can be aroused. If you can't rouse them, now we're a little bit more concerned, okay? So I would still recommend that you do that. It goes against kind of some of the current guidelines. The current guidelines have been put in place to say, well, concussion's a metabolic injury. It's an energy deficit. We need their rest, which is true. But the evidence right now shows that waking them up doesn't actually worsen their recovery outcomes. And you could actually do some benefit by waking them up. So I would actually just stick with that. All right. Step 2. So the first step is find a trained healthcare professional. Step 2 is start eating healthy immediately. Concussion is an excitotoxic event, meaning that it affects our cellular metabolism. It affects how our brains process energy. We also have these things called reactive oxygen species, which are highly kind of inflammatory kind of processes that happen, and we can start to damage some of the nervous system. Now, after concussion, we also get increased permeability of our gut, meaning that the foods we eat can start leaking through our gut lining, and that creates an inflammatory reaction in our body. So you have a brain injury, which causes inflammation of the nervous system. You have a metabolic injury going on, which affects the way our cells produce energy. And then you also have this gut thing, which produces more inflammation in your body, and that inflammation travels up to the brain as well. So you have this cascading effect, and they call concussion a neurometabolic cascade. So what we want to do right away is be feeding our brains the right type of stuff. Processed foods, sugars, and even common food allergens like even gluten and dairy, and in some cases eggs. People can have sensitivity, so those are the common ones. Some people can be sensitive to all sorts of different things, so it's too hard to pick those up. But if you take the common ones out, the sugar, the dairy, the gluten, those are the big ones. And if you avoid all kind of artificial sweeteners and all processed meats and processed foods in general, and just eat whole, healthy foods, high fat, high protein. That is the best for reducing inflammation and kind of getting the brain to settle down a bit. Now, there's not a lot of human evidence on this yet, but we've seen it in animal studies. And we apply this because it's healthy for life. And I've seen it anecdotally in my patients where providing them and just switching their diet, even patients that have been suffering for years and years and years, switching their diet and taking some of that stuff out, all of a sudden lowers the inflammatory process and their head clears. People that have had fogginess forever, they're just like, oh my God, I feel clear and I can think straight and I'm sleeping well and I have more energy. And oh my God, this whole time I've been dealing with just gut issues, right? So there's a thing called the gut-brain axis. Concussion affects gut permeability, and that affects inflammation. So the quicker you can get on that, the better you are. The evidence shows that within 2 to 3 hours, your gut permeability is increasing, so that's already underway. So the best thing you can do is A, find a trained practitioner, and B, cut out all the crap and try to eat as healthy as possible for the first 3 to 4 weeks after your injury. You will set yourself up for a much better recovery, trust me. Step 3, moderate rest for 24 to 48 hours. Okay. We used to say, oh, be in a dark room, bed rest, like cocoon therapy, don't watch TV, don't talk to your friends, complete brain rest, try to shut your brain off. Guess what? You can't shut your brain off. It just doesn't work that way. And going and lying down and being immobile actually is worse, right? After concussion, we have a reduction in brain blood flow because our autonomic nervous system starts to dysregulate. And going and lying in bed, if you didn't have a concussion and you lied in bed for 24 to 48 hours, that's how much time it takes for your autonomic nervous system to dysregulate and for you to start having brain blood flow issues. So rest alone will affect your brain blood flow. Concussion alone will affect your brain blood flow. Get a concussion and then go rest, and then that will affect your brain blood flow more. And we're finding that absolute rest is one of the worst things you can do. So now the recommendation is moderate rest. So you want to kind of take it easy, but you don't want to be in complete bed rest. Go on walks, right? Read a book if you can. Anything that doesn't provoke your symptoms to a significant degree and doesn't increase your risk for getting another concussion. Like, you don't want to go play sports because if you get another concussion in this vulnerable stage, that's a bad thing. But you can go for a walk, you can do household chores, you can read a book, you can go on your phone a little bit, you can watch a little bit of TV, provided it doesn't provoke your symptoms to a significant degree. It's okay. Okay? So that's kind of the rule of thumb. Take it easy for a day or two, maybe take a day or two off school and work, so you're not completely kind of bombarded with stimulus. But it's okay to do some activity. Stay mobile. Keep active. Don't just lie around and do nothing. You want to be kind of up and about doing stuff just in a nice controlled, take it easy. Picture it like a lazy Saturday. That's kind of the description that I provide to people. Screens. All right, so here's kind of the thing. Screens and avoiding of screens, that's another kind of old wives' tale. We've told people that screens are bad for concussion recovery, but we actually don't have any strong evidence that they are. There was a recent study that came out that found that those that were on their phones more did worse than those that were on their phones less, but there's no real evidence that any type of screen time is going to be harmful for you. So I would say try to limit it, but you don't have to be completely avoidant of it unless it's bothering you. If it's not bothering you, then it seems to be okay. Now, there's only been a couple studies on this, like I said, so things may change. But at the time of this video, we don't really have a lot of strong evidence that screens are going to be harmful unless it's excessive amounts of screen time. So do what you can, and it's actually better for your recovery. For 24 to 40 hours, take it easy, and then you want to gradually start building back up. We find that too much rest, too much inactivity starts to make things worse beyond about 2 days. So that's kind of the optimal time frame. 1 to 2 days of just kind of taking it easy. Then you want to build back up. Start to challenge your nervous system a little bit. Start to increase your physical and cognitive capacity. That's the best thing that you can do. Step 4, early rehabilitation, right? We used to think that there was no treatment for concussion, and actually now we're finding that there is actually treatment for concussion, and it improves recovery substantially. Let's take the first one here, sub-symptom threshold exercise. Exercise is medicine. All right. Exercise improves our brain blood flow, improves the balance of our autonomic nervous system, reduces inflammation, boosts mood, does all of these things that help with concussion recovery. But yet for years, we've been told to not do any type of physical activity. Now, I will say this, too much physical activity can make things worse. So you want to make sure you know what your threshold is. So there's a test called the Buffalo Concussion Treadmill Test. All CompleteConcussions.com clinics do this. So if you need to find a clinic to get a Buffalo treadmill test done, this should ideally be done within the first 5 to 7 days after concussion. And if it's been beyond that, if you're 3 months out, you definitely need to go and start doing this, because what happens with the treadmill test is we find what your heart rate threshold is. When do you start to have this increase in symptoms? And then what we do is we give you a percentage of that and we have you work below that threshold. So you're doing it in a safe and controlled way. And then we gradually bump you up from there based on your treadmill test results. Starting exercise in this manner within the first week after concussion has been found to reduce the chances of prolonged symptoms by 50%. So basically half the people that go on to have prolonged symptoms could be cut out if they just started exercising within a week after their concussion injury. And here's the study from The Lancet that was published by John Leddy and company from the University of Buffalo. He's been on previous podcast episodes of mine. If you want to dive deeper into that topic, go and check out those videos or those podcast episodes. But you can see here, on survival analysis, controlling for sex, site, and mean daily exercise time, patients assigned to aerobic exercise were more likely to recover within 4 weeks after injury compared to those assigned to stretching exercise, with a 48% reduced risk of persistent post-concussion symptoms. You're basically dropping your risk in half. So exercise is one thing. That's just exercise, dropping you by 50%. Check this out. Rehab in other facets. So Catherine Schneider at the University of Calgary has done a lot of work on this. And in 2014, they published a randomized control trial where they compared people getting the usual standard care of treatment, which is basically rest and do nothing until you're better and then come back. And then they had people getting neck work, so manual therapy of the neck and rehabilitative exercises for the neck, as well as rehab exercises for the vestibular system and the balance system. And what they found was that if they started rehab within 10 days after injury, after 8 weeks, 73% 73% of the group that got rehab had been cleared to return back to all activities. The group that wasn't getting any rehab and was just getting usual care and doing nothing, which a lot of people will still just recommend, just wait. There's the only thing they can do is time. 7% had recovered. So 73% recovery versus 7% recovery. And that's just with the rehab. If you add exercise and rehab, now you're looking even better. Now here's another one from Reneker, 2017. They had a treatment group for vestibular therapy versus a sham treatment group where they were getting some like kind of bogus rehab that wasn't really therapeutic in any way. And they started at day 10. Again, still symptomatic at day 10. You should be starting in with rehab for your neck and your vestibular and maybe your ocular motor system. And they found that the treatment group recovered 2 times faster than the group that wasn't really getting therapeutic treatment. All right. So early rehabilitation is key to concussion recovery. If you look at the research will show that if we just leave patients alone, if we give them the typical, yeah, just go home and take it 2 weeks off, you'll be fine. 30 to 40% of those will still be symptomatic after a month. And then after 6 months, a quarter of all concussion patients won't even be back to work. So you're meaning long-term disability. So think about this. Can you afford to be off for the next 6 months? If you just had a concussion right now, can you afford to be on long-term disability or without a job, without an income for the next 6 months? And if you're unemployed by 6 months and you're not back to work by 6 months, your chances of not being back at a year are going up higher and higher and higher, right? So you have to think, let's do the right things now and take the right steps now, because I don't want to end up in a situation where I'm 6 months out and I'm not even back to work yet. I'm on disability. And you can change this. This is completely preventable. 30 to 40% of patients, if we just let them do nothing, will have prolonged symptoms beyond a month, and a quarter of them will not be back to work after 6 months. At Complete Concussions, we find that less than 5% of our patients are still symptomatic at a month, and maybe less than 1 or 2% miss a few weeks of work, right? Not 6 months, because we're just employing this stuff early on. It is the key to concussion recovery. So let's do a quick summary. Step 1, find a trained healthcare professional. Trained healthcare professional, okay? If they know what they're doing, they can really improve your outcomes. If they don't know what they're doing, they can really make you worse. So make sure you are thinking about that right there. Don't know where to start? Go to CompleteConcussions.com. We have clinics all over the place. If there are any red flags, any worsening condition, if it's within the first 24 to 48 hours, or if you're at all unsure, be safe, take them to the hospital, and kind of let them figure that out. Step 2, start eating healthy right away. Cut the crap, okay? Processed, chips, pop, whatever it is, get rid of it. You want to be fruits, vegetables, high quality protein, high quality fats, things like avocados and nuts and seeds and things like that. Step 3, take it easy for the first 24 to 48 hours and then gradually build back up. This should be monitored by a trained healthcare professional. They can help you along the way. Step 4, a Buffalo concussion treadmill test should be done within the first 5 to 7 days, and a sub-symptom threshold exercise protocol should be initiated based on the results of that, and you should be retested every week until you pass. That's just how it works. Step 5, you should be getting rehab on your neck, manual therapy on your neck, and rehabilitation for your vestibular and ocular motor system within 10 days of your concussion injury. And if you do those things and you find the right person to guide you, concussion recovery, 95% of you will be completely recovered within a month, and I would say closer to 99.9% of you will be recovered shortly thereafter, maybe 6 weeks. But the most of you will recover within the first few weeks if you're doing this stuff early. So that's it for this video. The next video, if you've had symptoms for longer than that 10 days and you're already at 6 months or you're already at 6 years, the next videos we're going to talk about what's called persistent concussion symptoms, formerly known as post-concussion syndrome, which is the long-term effects. How can we then figure that out and then treat that? Because it is treatable. So make sure you hit the subscribe button. Make sure you hit the bell notification icon so that you can get alerted when I launch those next videos, and you can follow along in the process so that we can help you recover from your concussion injury. If you're struggling right now, check out the links below because they will be able to help kind of guide you through this process and give you all sorts of valuable information to help you recover from your concussion. And I'll see you in the next video. Thank you so much for watching, and be sure to share this video if you have somebody you think might enjoy it.